Good morning. Today we start lecture number 1, Diseases of the Ear. Earwax. Up to 200 glands secrete earwax. From 12 to 20 milligrams secreted every month. Visual characteristics. Yellow secret of the external auditory canal. Water insoluble, normally removed spontaneously during chewing movements. Causes of cerumen plaque. Age, use of hearing aids, mobile headsets, music players, excess hair growth in the ear canal, chemical and dust irritations, frequent cleaning of the ear canal, anatomical features, defects, cerumen plaque density, swelling and obturation of the ear canal after water entered the ear canal. Symptoms: occlusion, the feeling of the ringing in the ears, otolgia, decrease or loss of hearing, only with full occlusion, dizziness and discoordination, external otitis. Earwax removal techniques. First, manual removal with a special hook, here it is, irrigation of external ear canal with warm water, here it is, and solution for earwax dissolution, for example, acerumen or Vauxhall. External otitis. External otitis can be circumscribed or diffuse. Treatment: it's local antibacterial therapy. Then, otomycosis, may caused by Candida or Aspergillus. Treatment: local antifungal therapy, candibiotic, nitrofungin, clotrimazole, miconazole, pimafocin, exerudryl, and so on. Otohematoma. Here it is, you look at the picture. Otohematoma is a limited accumulation of blood in the area of the auricle that has arisen spontaneously or as a result of blunt trauma, without violation in the integrity of the skin, clinically manifested by the gradual or simultaneous formation of a round of oval fluctuating protrusion in the upper third of the ear. Palpation is usually painless, but if the perichondrium is damaged, the patient experiences pain. The patient also complains of a feeling of fullness in the area of the auricle. Small otohematomas require a pressure bandage. With large otohematomas, it is necessary to puncture the contents to prevent complications in the form of an auricular abscess, followed by the calling of a pressure bandage. Erysiperal. Predisposing factors: trauma, cut, abrasion, burn, penetration of streptococcus, reduced body resistance, immunodeficiency, hypothermia, chronic alcoholism, AIDS, leukemia. Symptoms: redness of the ear, edema, acute pain, redness always covers the lobe. Treatment: broad-spectrum antibiotics and ultraviolet irradiation. Acute middle otitis. Among the total number of ONT pathology, from 20 up to 30% of cases. High probability of severe complications such as meningitis, brain abscess, sigmoid sinus thrombosis, labyrinthitis, facial nerve palsy, mastoiditis, sepsis. Up to 95% of children suffer at least one episode of acute media otitis in the first 7 years of life. Etiology: Streptococcus pneumonia, Haemophilus influenza, Moraxella catarrhalis, Staphylococcus aureus, Staphylococcus pyogenes, and respiratory viruses. Pathogenesis: production of the general and local immunity. Ways of infection spreading in the middle ear are: first, rhinotuberous; second, traumatic; next, hematogenous. The condition of the nose and nasopharynx also very important. The structure of the mastoid process may be pneumatic, diploatic, sclerotic. changes in the ear that have arisen as a result of the previously transferred diseases, and age. Stages of acute media otitis. First, before perforation. Second, perforation or purulence. And the last, reparation. Before perforation stage of acute media otitis. Catheteral inflammation causes filling of the middle ear with serous fluid, transudate. Hearing loss and low-frequency noise in the ear. With the transition of the transudate to purulent exudate, the activity of the inflammatory process maximally increases. The pressure of the fluid in the ear also increases. Severe pain in the ear and head. Body temperature up to febrile. General intoxication appears. Treatment. Vasoconstrictor nasal drops, analgesics, drops to the ear, Otipax, Flottac, antibiotics. Symptomatic therapy. Tympanic puncture or paracentesis of the eardrum. Antibiotics are prescribed only for children before 5 years age. Second stage, perforated stage of acute media otitis. Begins after the paracentesis of the eardrum or its spontaneous rupture. Appearance of purulent discharge from ear. Disappearance of pain in the ear and intoxication. Normalization of body temperature. Treatment. Antibiotics. Cleaning in the ear canal. Drops with antibiotic to the ear. Otofo, norfloxacin, Normax. Third stage, reparated stage of acute media otitis. Begins after healing of the eardrum perforation. Hearing loss, low frequency noise in the ear. Treatment. Blowing of the auditory tube by Valsalva Politzer. Catheterization of the auditory tubes. Pneumomassage of the eardrum. Acute media otitis in children. The clinical picture depends on the age of child. In newborns and infants, acute onset, restless behavior, sleep disturbance. The rapid increase in temperature to febrile digits. Anorexia, intoxication, weight loss, dyspepsia. Dura irritation or meningism. Children from 2 up to 7 years. Earache, fever, hearing loss, headache, irritability, loss of appetite, sometimes diarrhea. Mastoiditis. Predisposing factors. High virulence of infection, reduction of general and local immunity, difficult outflow of pus. Stages of mastoiditis. Mucoperiostitis, osteitis, osteomyelitis. Pathognomonic symptom of Schwartz. It's overhead of the posterior surface of the external auditory canal in the bone part. Atypical forms of mastoiditis. Bilocalization. Apical cervical mastoiditis, Betzold or Leans-Ichitelli. Zygomatitis, squamitis, etrositis, Rodeniga triad, Otitis media, trigeminitis. Paresis of the abducens nerve. With flow, may be latent or fulminant. Operation treatment, entromastoidectomy, slanting of the mastoid process and removal of the affected bone. In newborns, arthritis, 2 forms of arthritis, explicit and latent. Treatment, enterotomy or arthrodrainage. Secretory middle otitis, chronic middle ear catarrh. Secretory middle otitis, catarrhal inflammation of the auditory tube, which leads to violation of its drainage and ventilation function and appearing in the tympanic cavity of aseptic contents, transudate. Causes. Pathology of the nasal cavity, paranasal sinuses, nasopharynx, hypertrophy of the pharyngeal tonsil, deviation of the nasal septum, sinusitis, rhinitis. Allergic rhinosinusopathia. Tumors of the nasopharynx. Atmospheric pressure changes, for example, in airplane. Symptoms. The general condition of the patient does not suffer. No pain in the ear, low frequency noise in the ear, fluctuated hearing loss when changing the position of the head, feeling of ear congestion, autophony. Diagnosis: in otoscopy, amber yellow color of the eardrum with the level of fluid behind it, the retraction of eardrum, the disappearance of the light cone. In audiometry, conductive type of hearing loss. In tympanometry, tympanogram type B, no vibration of eardrum. Treatment. Treatment of the nasal cavity, nasopharynx, pharyngeal sinus pathology. Catheterization of the auditory tubes with the introduction of proteolytic enzymes, corticosteroids with other antibiotics. Pneumatic massage, physiotherapy, tympanopuncture, myringotomy and shunting of the eardrum. Tympanoplasty in development of chronic adhesive otitis media. Transmastoid drainage of the antrum and middle ear space. Chronic purulent middle otitis. Suffer about 0.1% of the population. Lead to hearing loss. There may be intracranial complication, labyrinthitis, periods of the facial nerve. Predisposing factors: immunodeficiency, microorganism virulence, condition of the upper respiratory tract, previous ear diseases, the type of structure of the mastoid process. Signs: separation from the ear, constant perforation of eardrum, and decreased hearing. Forms of the disease: mesotympanitis, epitympanitis, and epimesotympanitis. Cholesteatoma is a tumor-like formation that contains hollow, desquamated epithelial cells and a mixture of other substances, keratin, cholesterol crystals, which is surrounded by the epidermal connective tissue sheet, the cholesteatoma capsule matrix. Examination: X-ray of the temporal bone, CT of the temporal bone, MRI of the middle ear, bacteriological examination, audiometry, consultation of neurologist and ophthalmologist. Conservative treatment. First, general treatment. Second, sanation of the nose and nasopharynx. Third, local treatment. First stage, mechanical removal of pus from ear. Second stage, the introduction of drugs into the tympanic cavity. Here you see irrigation of the tympanic space and introduction of the drugs into the tympanic cavity. Operative treatment. Radical operation, ectotomy, eticoantrotomy with mastoidoplasty, entrodrainage, posterior tympanotomy, and tympanoplasty. Indications to the radical operation in the middle ear. Absolute indications: otogenic intracranial complications, caries of the walls of the middle ear, cholesteatoma, chronic mastoiditis, periods of the facial nerve, and labyrinthitis. Tympanoplasty. Here you see 5 types of tympanoplasty by Wolstein. First, myringoplasty. Second, large tympanic cavity. Third, small tympanic cavity, columella effect. Then, fourth, reduced tympanic cavity. And fifth, fenestration of the horizontal semicircular canal. Otogenic intracranial complications may be purulent, extradural abscess, subdural abscess, brain abscess, temporal lobe and cerebellum, otogenic meningitis, otogenic sepsis, sinus thrombosis. Non-purulent, treated by neurologists, otogenic arachnoiditis, otogenic hydrocephalitis. Ways of infection spreading to the cranial cavity: contact, pyoperformed pith, labyrinthic, hematogenous, and traumatic. Groups of symptoms. General. Febrile temperature is constant or hectic in sepsis. Intoxication, tachycardia, inflammatory changes in the blood, urine. Cerebral. Diffuse in meningitis or local headache, nausea, central vomiting, hallucinations, bradycardia, in marked increase of intracranial pressure, abscess of the brain or cerebellum, edema of the optic nerve. Meningeal. The position of a trigger or a dock. Tension symptoms. Rigidity of the occipital muscles, Kernicks, Brudzinski symptoms, upper, middle, lower. Pathological symptoms, Babinski, Rossolimo, Bechterev. Symptoms of local brain affection. Temporal lobe, motor disturbance, convulsions, aphasia, alexia, acalculia, cerebellum, hypotension of the affected site, ataxia, spontaneous streaking, adiadochokinesis, large or medium nystagmus to the affected site. Differential diagnosis of pathogenic meningitis with tuberculous meningitis, epidemic transthinal meningitis, and serous or viral meningitis. Liquor inotogenic meningitis. Increased pressure, normal 60 drops per minute. Turbid, pleocytosis, hundreds and thousands of cells, mostly neutrophils, the norm 310 cells in 1 milliliter. Increased protein content, amount of sugar and chlorides are reduced, and microbiological examination. Contemporary diagnostic methods: CT with contrast and MRI. Principles of treatment: first, surgery, radical operation; second, medication, antibacterial, dehydration, detoxification, anticoagulants, sinus thrombosis, and symptomatic. Sensorineural deafness. Up to 4 weeks acute, treatment efficiency in 70–90%. From 1 to 3 months subacute, the effectiveness of treatment is 30–70%. From 3 months chronic, the effectiveness of treatment is doubtful. Types of sensorineural deafness: congenital, acute, and chronic, may be stable and progressive. Etiology: inflammatory, influenza virus, herpes zoster, oticus, mumps, measles, epidemic meningitis. Toxic, iatrogenic, aminoglycoside antibiotics, aspirin, Lasix, cytotoxics, anti-tumor antibiotics, heavy metal salts. Traumatic, mechanical injury, transverse and longitudinal fracture of the temporal bone pyramid. Acoustic, explosions, firecrackers, headphones, discus. Barotrauma, pilots, submarines, drivers. Vascular, ischemic, hemorrhagic, thrombosis of arteria auditiva interna, vertebral-basilar insufficiency. Symptoms: unilateral or bilateral hearing loss, mainly at high frequencies. High-frequency noise in the ear, ringing, squeaking, buzzer. Vestibular disorders, vertigo, nausea, vomiting, static disturbance, nystagmus. Normal otoscopic picture. Diagnosis: thresholds and over-thresholds audiometry. Otoacoustic emission. Examination of spontaneous evoked stem potentials. Tympanometry, impedancemetry. CT scan with contrast or MRI of the brain. Early detection of deafness and severe hearing loss. Screening of newborns. Hearing aid, hearing apparatus. Cochlear implantation. Specialized child schools for the deaf. Otosclerosis. Etiology is still unknown. Heredity, the familial character of the disease, especially in the female line. Endocrine disorders often occurs in a woman after pregnancy, childbirth, menopause. Abnormal structure of mesenchyme patients have frequently of bones, blue sclera. Pathogenesis. The development of bone tissue in the area of the circular ligament of the stapes. It can spread to the cochlea, leading to sensorineural hearing loss. Symptoms: progressive hearing loss and severe tinnitus. It begins within 1 year, but quickly occurs with a bilateral lesion. Paradoxical symptoms: paracusis of Willisii, patient hear better in noisy environments. Forms of otosclerosis: tympanic, cochlear, and mixed. Treatment: treatment is only operative. Operation: stapedectomy with piston stapedoplasty. Here you can see. Endolymphatic hydrops, or Meniere's disease. The etiology is unknown. It is caused by vegetative disorders in the inner ear. Pathogenesis. The mechanism of endolymph production and resorption is impaired. Symptoms: the disease is paroxysmal. The frequency and duration of attacks is individual. During an attack, there is a feeling of stuffiness, noise in 1 ear, hearing loss, an acute attack of rotational dizziness, which is accompanied by nausea and vomiting. In the remission period, there are no signs of the disease, but with each attack, the hearing loss progresses. It may result complete deafness in the affected ear. Diagnosis: total thresholds and over-threshold audiometry, vestibulometry, electronystagmography, posturography. Differential diagnosis should be performed with labyrinthitis, acoustic neuroma, hypertension, and vertebropatellar insufficiency. Treatment: diet, beta-histine hydrochloride, diuretics, sedative drugs, tranquilizers, vestibular gymnastics, surgical intervention, and the lymphatic sac drainage, destruction of the labyrinth. Thank you for your attention.